not really how these things work. I mean, if you have a choice right now between a flu or a funeral, you're taking the flu, right? And this is essentially where we get to that. If you do get sick, I think on the data on the J&J clinical trial, 40,000 people were in a clinical trial, 20,000 got placebo, 20,000 got the vaccine. Of the 20,000 who got the vaccine, only 116 of them got COVID. So that's 0.5% infection rate. And after 28 days, when you're supposed to have your immunity, there were 0 hospitalizations. There was 1 early hospitalization from someone who got the vaccine group, but it was in that first 2 weeks when your body is still using the vaccine to build the antibodies. So the immunity threshold and protection hadn't quite taken root. So that's a good vaccine. So even if you could compare Pfizer and Moderna to AstraZeneca and Johnson, AZ and J&J are good vaccines. Maybe the mRNA are great vaccines, but a good vaccine is certainly better than no vaccine. And this is going to be a central public health message, is that she said the doctor who approves these things or plays a role in it says she would roll up her sleeve for any of the approved vaccines. And if the people who are approving it are willing to do that, it's not a bad bit of advice to take.
Yeah, it also, I gather, Catherine, works well against the variant of concern, which is also one of the tests, obviously. How well is the virus protecting against the mutations of the virus?
Yeah, and Dr. Sharma did talk about that today, that the various vaccines, they may have different levels of efficacy, but again, it comes around to this basic message from health officials in Canada, which is if you are offered a vaccine, you should take it. It is going to offer you considerably more protection than you would have otherwise. And of course, we know this is a very real, live conversation as we do start to see these variants of concern continuing to spread in different communities across Canada, looking at different numbers and seeing that even if the case numbers seem to be somewhat stable, and we should say they do seem to be creeping up in different places across the country right now. What is most significant, I think, to health officials is what proportion of those cases is proving to be these variants of concern, particularly the one that originated in the UK, which does seem to be showing that it is, particularly in this country, more contagious than the COVID that we have come to know over the course of the last year. I would note even right here in Ottawa, where things feel a little bit more comfortable than they have, let's say, in the past few weeks. The wastewater testing that they do here in Ottawa, which has been a really good predictor of where things are going to go, that's sending some really alarming messages. The numbers suggesting that the situation is as bad as it was back in November, and that we are likely to see Dr. Vera Etch is saying here in Ottawa, it looks like we're heading into a third wave. So again, it's just another example that points to the importance of the vaccination campaign, taking a vaccine if indeed it is made available to you. Today's news, obviously, good news in terms of there being other options out there, although, as David pointed out, we are still looking at what the timelines are going to be in terms of the availability of this particular vaccine.
Yeah, we do know for sure, though, that the government, because the Minister of Procurement, Anita Anand, has said this, is it keeps pressuring companies, keeps the foot on the gas, if you will, to try and get more in and and move up some of those deadlines, and has been somewhat successful with that, certainly with Pfizer. So we'll see whether they manage to do that. And AstraZeneca as well. They have managed to find sources of it from different places. Maybe we should just give David, and I think you have this in your head, probably do, a picture of how we're doing overall, because it's one thing to approve, it's one thing to procure, it's another thing to jab it in people's arms, and provinces are all going at different rates for that too.
Yeah, the provinces are going at different rates, but the trajectory is going up, and it's going to need to go up as supply is certainly going to escalate really between now and Canada Day. It's sort of the short-term metric that I've been focused on, because a lot of deliveries really start to come in big volumes in April. So we're anticipating a total of 6 million Pfizer and Moderna doses by the end of this month. That includes shipments up to date plus what's to come, and the 500,000 of the AstraZeneca Covishield that we got from the Serum Institute in India. So that's 6.5 million people. Some of that you have to discount because people have been double dosed, right, before the dosing interval decision was made. But that's, a good chunk of people, say 4 million, who can at least get their first shot. From April to June, there's going to be another 1.5 million from the Serum Institute. There's going to be 1.9 million of AstraZeneca through our COVAX agreement that's going to come from a facility in South Korea. There's 10.8 million Pfizer doses due to come and 12.2 million Moderna doses. When you add all that math up, you get to 32.9 million doses in Canada based on expected deliveries by the end of June. So that's enough to do the whole adult population at least once by Canada Day. Those
so and that's
numbers
just with, that's just with the 3 that were approved. That's not
that's just
adding
what we
in
got.
J&J. Right, yeah.
And also, so that doesn't include a single dose of Johnson & Johnson, which we're not going to see until April, maybe even May, depending on what happens with their supply and production issues. So those numbers will grow from there. And it also, Rosie, doesn't include any of our main AstraZeneca contract with the bilateral purchase agreement with AstraZeneca, which are doses that are going to come from the United States. Our AstraZeneca is kind of confusing. We have the India supply, the Korea supply, and the American supply. We don't have any schedule expectations yet from them. The deal is to get 20 million doses between April and September. I'm told the most of that is going to be weighted in the July to September period of time, but even if you get 4 or 5 million doses in the second quarter, or Q2, as Minister Anand would say, you know, that you're up getting pretty close to 40 million doses by Canada Day, you know, if supplies and deliveries hold. And as we saw with Pfizer, it moved doses from the fall into the summer, from the winter into the fall. It gave us some early doses in December. So there is this constant conversation to try to get things delivered early, and it's in the drug companies' interest to do that, to get us taken care of so they can move on to other countries and broaden it out, and just good reputationally to be the company that delivers big volumes as early as they can. So with the dosing interval being stretched out to 4 doses, with the approval of the Advisory Committee on Immunization, most provinces now are saying every adult over the age of 18, over the age of 16, if you use the Pfizer doses, who wants a vaccine should have at least their first shot by the end of June. And then it just rolls into the second dosing, and if Johnson & Johnson comes in, I mean, it is looking more and more likely that this end of September deadline, which General Fortin and Howard New and PHEC people are still sticking with, is going to move up pretty significantly. You know, maybe everybody by Labor Day, maybe everyone by the middle of August, fully done if these supplies hold, because the production is getting sorted out the longer we go into this. They just got to get it into the country, and then the country's got to get it into the arms.
Well, I was going to say, Catherine, that's a good point, because I think before you've made the point that the goal had been 1 dose by the end of September. But with what David's saying there, you could see how maybe we could be in a stage where actually you're getting your second dose by the end of September.
If indeed, and we can say this today, you're taking a vaccine that requires 2 doses, right? Because
That's right.
now we have this 1-dose option with Johnson & Johnson. I think it's also important to contrast what we are looking at in terms of the future and the moment that we're in right now, just the pressure that the government is feeling on this front. There has been a lot of good news, you know, in terms of AstraZeneca, Johnson & Johnson, and in its own way, this extending of the period for the 2 doses. Some folks, this is not going to come as good news. We know in BC officials, they're actually apologizing because people had appointments and suddenly those appointments are gone because they're deciding to use those doses as a first dose for another member of the population. But there is considerable pressure at this moment on federal health officials, right? I mean, Canada has dropped down. They're now more than 40 countries ahead of Canada in the global rankings. Canadians are looking at what's happening in the United States, and while they may understand that the situation is different, I think that does increase certainly political pressure on the government. There's new polling out today, once again suggesting that Canadians are blaming the federal government for the current state of things. So all of this ramping up, certainly a good counterbalance to a lot of that pressure. We should say, though, we heard it yesterday too from a couple of premiers in particular, some who are notably the most vociferous critics, we could say, of the government. But Jason Kenney and Scott Moe saying yesterday in that news conference that was meant to talk more broadly about healthcare funding, Scott Moe saying they've done a disappointing job at best of the federal government. Jason Kenney saying it's an embarrassment, it's unacceptable. So there are a lot of pressures weighing on the government right now, and I'm sure the more good news they can get out the door, the happier they'll be.
Yeah,
as will Canadians.
Yeah, you're absolutely right. I mean, we are, you know, I think everyone's in favor of more vaccines and approving vaccines, but the government is also obviously doing it for public health, but they're also doing it because of that pressure that they are feeling, and rightly so. They're feeling it from everybody. Everybody's anxious to get this done and get it over with. I think Ontario today, too, is going to start talking about a broader strategy as well. Ontario has also been under some criticism for not having the smoothest of rollouts to date, and so I think we're expecting an update later today, and things are going to shift, or are supposed to shift, in this province come Monday too, I think, David.
Yeah, Rosie, I just got a text from someone I was trying to get information out of earlier today and told that there's something else coming with the Prime Minister on vaccines. It's beyond the Johnson & Johnson, so we should expect some more news. He's running a little bit late. That is not surprising. That often happens, but if it is late confirmed news, that might also explain it. So there might be a double shot of vaccine news, the Johnson & Johnson approval this morning, and now something from the Prime Minister. You know? Stay
Catherine's
tuned
giving
for
you
more
that
dad
on
jokes.
television.
Yeah, but there is something else coming. So you know, while people are being criticized, it's interesting how. This is probably, I don't imagine I'd be getting the heads up if he's going to say Moderna is suddenly not coming. You know, it's probably going to be good news.
Yes.
But it's interesting how the conversation is evolving, right? In that, you know, Catherine just referenced Jason Kenney talking about the failure of Justin Trudeau. I watched his health minister, Tyler Shandro, yesterday say we're going to have everyone with a single shot done by the end of June, and that is a tremendous feat to get that done. So it is both a tremendous feat and a failure at the same time, depending on where you are in this conversation. But the supply issues are getting sorted out. It's the rollout issues that are going to become the focus. You know, there used to be endless questions of the government on N95s and surgical masks and gowns and gloves. We don't ask about that anymore because that is done. That is resolved. There's now domestic supply for most of these things. We are seeing reporting out of places like Nova Scotia, where Stanfield feel they got a little bit screwed around there on the gown manufacturing that they did by the federal government, and that they didn't get the tender, and they've lost some money on that. But the supply in the aggregate is there. The vaccine supply is sort of as a signal the government did, was ramping up towards the end of the first quarter and then growing quite dramatically in the second quarter. And then in the third quarter, there are really eye-popping numbers, like tens of millions coming in per month. But that's all been shifted forward. And this is, you know, the endless focus of the people at Public Service and Procurement Canada right now, being on the phone with the drug companies every single day, trying to do everything they can to move up shipments. So if it's something like that, I don't know. But the Prime Minister has surprised us in the past with bad news, for example, when Pfizer shut down its facility in Belgium, and then good news when, you know, suddenly the Serum Institute was able to deliver. So stay tuned for something from the Prime Minister in the next little while.
Okay. I would point out, too, like to Catherine's point about, well, both of you made the point, but we see these numbers coming in, more vaccine approved, all of this is great. But I think it is a natural human tendency to compare yourself to others, particularly for us to compare ourselves to the United States. And I'll just tell one little story from my show that I did on Sunday. There was a lovely lady named Selma who was 86 and was getting her vaccine this week, and she got it, and it's all good. But she had decided to stay in Montreal for the first time in very, very long time and not go to Florida, where she would normally go and spend her winters to make life easier on herself. However, many of her friends went down to Florida, and guess what? They've all got their doses. They've all had both their vaccines, and she's just getting started. So, you know, I mean, it's just a little anecdote, obviously, in one person's experience, but I think that is the kind of thing people are thinking about as they watch this unfold, and that's probably where some of the frustration lies. I do think today, too, Ontario, and this is a conversation that's happening across the country and being managed by provincial authorities, also, who is getting it, right? So yes, long-term care homes, frontline healthcare workers, but then as you start to go down the list, the conversation becomes a little more complex and a little more difficult. Do you just stick to age, or do you start looking at other vulnerabilities or other people's, the kind of work they do? And I think that's sort of the next part of this that could be difficult, and I'll get you to weigh in on this, Catherine, could be difficult for provinces to manage, right? It's not just about picking the year you were born. There's a whole bunch of other things that have to come into consideration.
Yeah, I think we've already seen how heated those discussions can be in some cases. Look at, for example, the instance of homeless populations. And there are particular places in the country, I can think of Toronto area, Montreal area, where they have said, okay, these are people we need to prioritize because of the difficult circumstances, the vulnerability. Or we talk about, you know, remote Indigenous First Nations. Again, another decision that has been made by certainly federal recommendations, but the decisions that actually have to be made in the provinces in terms of who gets priority, who is most vulnerable. And so maybe those decisions are a bit more self-evident when we are talking about the very early phases of this, but they could become certainly much more complex. We've seen this in other countries as well. When you start talking about, okay, well, do we prioritize people? Do we just keep looking at this by age? Do we look at pre-existing condition? Should grocery store workers, for instance, or you know, what they're doing in the United States in terms of prioritizing teachers and other people who work in the school system. These are all going to be, I think, very live, active discussions going forward. Certainly these are discussions we want to be having, right? We want to be at the point where we are advancing things, but they are very sensitive discussions, I think, as well, because of course, I mean, listen, it's been a year of this. We're all exhausted. And some people in particular have been feeling an incredible amount of pressure and been feeling incredibly vulnerable. And so what are we going to do? What kinds of decisions are we going to make as a society in terms of trying to help those who are most in need?
Yeah, another example of that is police officers. Toronto and Ottawa have designated a certain number of police officers that are getting vaccinated first. In the case of Toronto, they are not actually able to point to outbreaks that have occurred and caused infection with Toronto police, for instance. So does that make sense because of their interactions with people, or does it make sense to target, you know, a meat packing plant where there have been large outbreaks? So it is a more complex conversation than it is at the beginning. But you're quite right, Catherine. That's the conversation we want to be having. We are waiting for the Prime Minister at this hour. He is running late, but he's expected to appear just shortly to give us apparently some extra news, David says, that we don't know yet, but also to take questions about the approval of Johnson & Johnson and other updates that he might have for the country on the pandemic. I do want to touch on kids for a minute because that did come up in the press conference, and I do think it's something that's on the mind of a lot of Canadians too. David, I think you said is Moderna 16 and up, or is it 18 and up?
Pfizer 16 up. Okay. Everything else is 18 and up, and there are various clinical trials going on in the various age groups to try to figure out, because this is the way this works, right? We do clinical trials on adult populations, and then you do the pediatric trials, as they're called, afterwards, you know, because it's a more difficult issue in dealing with informed consent with minors. So there is the Johnson & Johnson vaccine will undergo I think an age 12 to 17 clinical trial in Canada. That's going to be the first non-adult clinical trial done on Canadian soil at sites in this country. That's one of the bits of news that Dr. Sharma announced today. There are other clinical trials going on at various cohorts with the other vaccines globally. I'm gonna give you the ranges. I think correct me if I'm wrong. I apologize, but it's usually like 12 to 16, 9 to 12, 6 to 9. 2 to 6, and then 6 months to 2 years. So they do them in staggered cohorts like that and work their way down. So this is happening. It would be optimistic, as Dr. Sharma said today, to expect a vaccine approved for young Canadians by the start of the next school year in September. That aligns with what I've heard Dr. Anthony Fauci say in the United States, where he thinks you're looking at first quarter of 2022 before you get a vaccine for kids approved. He did suggest there is an outside shot. You might see something for older high school kids by this fall. Now, older high school kids would be Pfizer in Canada's case, 16, 17, 18 years old. So that is sort of the, you know, while we're figuring out, like, should we use AstraZeneca on over 65? We have now 3 clear options for over 65 in Johnson, Pfizer, and Moderna. That's the next big piece of the puzzle, right? Is certain people with immune deficiencies that need to be sorted out, and the entire population essentially under the age of 16 that needs to be figured out. The work is happening there. It's a little bit in the background as we deal with, you know, the broad strokes of the vulnerable population. Because, you know, going back to the conversation you and Catherine were having on, do we vaccinate this group or that group? I mean, when you look at mortality and serious illness, it's age, and then you get the pre-existing conditions before you really look at the groups of people that it strikes terribly.
Or congregate living settings, I would say.
Yes, of course. That's for spread. That's for spread, for sure. Yeah. But, like, you know, the vast majority of the deaths in this country are congregate living, seniors living in long-term care homes, and that has to remain the urgent vaccination priority. And luckily, those conversations should be a little bit easier if these supply boosts continue the way we are anticipating, that you're spacing it out by days and weeks as opposed to months and months when you move through these various groups.
Catherine, did you want to weigh in on the children thing? Because I do think it is something people are concerned about. And then I think it raises questions too. So kids just go back to school, but they're the only ones not vaccinated? Like, how is that going to work?
Yeah, and the restrictions it continues to put on kids. I mean, I believe Dr. Sharma said something to the effect of, you know, at the end of the calendar year, maybe we're starting to look at this data, but like certainly she was not making any predictions, let's say. It's clear that this is something we're still talking about being months and months away. And I think it's just important to touch on what a real concern it is for so many parents. You know, when we talk about the lockdown situations that we are going through, and we know there are so many parents looking at their young children, their teenage children, and they're very concerned about the impacts on mental health. So yes, they're going back to school, great, but if there's still risk of contagion, you know, how much does that really change things? Now you have to imagine having the entire adult population vaccinated by September, as the Prime Minister and federal officials continue to insist is the goal and the likelihood that is going to diminish the presence of COVID greatly in our communities, and thus diminish the risk for young Canadians. But, you know, outbreaks are still a real concern. We do see them in school environments, and it is, we can only imagine. I'm certainly not a school official nor a public health official, but it will continue to have, we would imagine, restrictions on their behavior, and that is certainly going to be an ongoing concern. I mean, I'm talking about it from the perspective of parents, but obviously from the perspective of these teens and young people as well, and it has very real-world impacts beyond them, but also on you know, people's ability to be present in the workforce and whatnot. And I would just add one more thing, Rosemary, that we didn't touch on as we talked about the various groups that might be up for special consideration. We should also talk about racialized Canadians and the fact that the limited data that we have seen on that front suggests that they are often being hit harder by cases of COVID, certainly, than the population as a whole, and that will also be part of the discussion, I think, certainly in some quarters, in terms of how we make decisions about who gets vaccines when.
For sure. I am told he's coming soon. That was the latest information that
That's a relative term in this country with this Prime Minister.
Yeah, with any Prime Minister, really, I've noticed. I would also just point out that, you know, David, you talked about Alberta saying what its timeline was. It does seem as though provinces are sort of moving up their own schedules and calendars. Manitoba, for instance, saying that every adult, just this morning, saying that every adult could get a shot by May 18th. I mean, that's a lot faster than what we had initially heard, and it's certainly faster than even the goals that the federal government was giving itself. So, you know, and that's without, as we say, without any Johnson & Johnson, without other things that we don't know about in terms of the speed of delivery.
Well, as soon as the Prime Minister comes out, I'm going to try to find a house to buy in Manitoba so I can get on that list and get done by the middle of May.
You can live with my parents. You can live with my parents, yeah.
Yeah, look, it's gone from a grim vaccine story, the low point of February in particular, where we had weeks where not a single dose of vaccine was coming in, to this 2-week period where 1.8 million doses are coming in, right? Just think about that. That is yes, we're behind the United States and the United Kingdom and Israel, which is, you know, the global outlier, you know, of all countries. But if you look at the rankings and the curve, you're starting to see a convergence now of Canada catching back up to the European Union countries, which are good comparators, like France and Germany and other members of the G7. And you have to also look at the fact that some of the other countries Canada lags behind in the global rankings are using Chinese and Russian vaccines, which were never up for consideration in this country and would have been a very difficult sell, I think, given our geopolitical relationship with those countries right now, with a population where you're already dealing with vaccine hesitancy for things that have been around for decades, like the measles. You know, good luck getting people to take a Sputnik vaccine in bulk when it skipped stage 3 clinical trials in Russia. So you have these sorts of challenges out there when you're looking at the global comparisons. So maybe the Prime Minister is late because he's bringing in a pallet of Moderna doses or something. I have no idea. But the numbers are going in the right direction. The challenge now is to not become too completely complacent, because I know, like, these conversations we are having as we tread water for the Prime Minister, you know, they've gotten a little bit more optimistic and a bit more hopeful, but we go back to what, you know, Catherine mentioned, that Vera Etches, the Chief Medical Officer here in Ottawa, says a third wave is on its way to this city, a city that's handled COVID pretty good in the big scheme of things, and that, you know, there is an uptick in a lot of places, and you're looking at maybe restrictions being lifted in Peel and Toronto and some of the big hotspot areas in southern Ontario. There is still a real challenge ahead of the country, you know, rather than to get too too complacent and too loose on things right now. It's to look at the hope that the vaccines offer and use that as sort of the lodestar to get you through the next 8 to 10 to 12 weeks, which I know after 52 weeks is unpleasant. But boy, that's it's a miracle that we have 4 vaccines in this country ready to go a year after this. Like, it is an absolute miracle of science, and it just shows you the valuable of a useful educational background in things like drug research and mRNA vaccines, and it's incredible that we're here. But man, it's not done yet.
No. My mom says you're welcome anytime. She's already tired.
You know, Rosie, I was talking to people back in Newfoundland because my dad is there. He's in his 70s. He has pre-registered for his vaccination.
Yes, my parents have too. Yeah,
and there's a better than average chance that he's going to get Pfizer or Moderna before the end of March. And when that happens, my stress levels will decrease by a fairly substantial percentage, you know, because of just what that means. And like, this is the story that is happening every day across the country. Now it's 70,000 people a day getting those shots. That's a lot of people and a lot of families who the stress level is just diminishing as the country finds itself in a better place.
There is this issue of vaccine hesitancy, and I only bring it up because Dr. Sharma was asked about it this morning too, Catherine, and I thought she was very thoughtful about it. She didn't, you know, she didn't diminish people's concerns or their actual questions. That I don't think is the way that she wants to approach those kinds of questions.
No, and it's not. I think we know from research well before COVID that that's actually not a terribly useful approach when we talk about vaccine hesitancy. And in this particular instance, and I think Dr. Sharma pointed to this morning, you know, it's a real spectrum when we talk about people who are not necessarily ready to take a vaccine, right? I mean, it can be everything from people who are buying into baseless conspiracy theories about the origins of the vaccines and why people are being asked to take them. But there are plenty of folks who are just trying to understand what is happening and who are asking questions about something that's going to be injected into their arms. I mean, we know that this even happens amongst healthcare workers, which may be surprising to a lot of people. But, you know, people have questions, and Dr. Sharma said, and perhaps we'll hear it from the Prime Minister here right now as well, that they're trying to get people those answers so that they can feel assured of what they're taking. Yeah,
information is important, which is what we try and do here as well. But we'll be quiet for a moment and let the Prime Minister talk, and we'll come back after he's finished. Here now, the Prime Minister of Canada.
I'm happy to be joined here today by Ministers Anand, Haidu and LeBlanc, as well as by Dr. Tam and Dr. New. There's a lot to cover today, so let's get right to it. D'abord,
first, I'd like to give an update about the vaccines. This morning, Health Canada authorized the Janssen vaccine against COVID-19. This is very good news. I would take this opportunity to remind you that Canada has a world-renowned independent review process. When a vaccine is approved by Health Canada, this means that the best experts concluded that it is effective and safe.
This morning, Health Canada authorized the Janssen COVID-19 vaccine. This is a single-dose vaccine. It can be stored and transported at regular refrigerated temperatures from 2 to 8 degrees Celsius, which makes it easier to distribute across the country. As with all of the other vaccines we have secured, we're working to get doses to Canadians as quickly as possible. Canada has an agreement with Johnson & Johnson for 10 million doses of this Janssen vaccine between now and September. This morning, I spoke with Jorge Bartolome, the president of Janssen Canada. He told me that they are committed to getting the full order of doses to Canada, and they're working on setting up global supply chains as quickly as possible. There are now 4 safe and effective vaccines approved by independent regulators in Canada. We have agreements with all 4 companies making these doses, and we also have agreements with 3 additional companies for their potential vaccines. Today, we also have some great news to share about Pfizer vaccine shipments. Pfizer has informed us that we are able to move up the delivery of 3.5 million doses from the summer into the next couple of months. Pfizer will be delivering an additional 1.5 million doses to Canada this March, moving deliveries ahead of schedule. We'll also be getting another 1 million doses ahead of schedule in both April and May. For months, we've been committing to you that we'll get 6 million doses total of COVID vaccines by the end of March. Well, because of the hard work of Minister Anand and the whole team, with these accelerated Pfizer deliveries, we'll now be getting 8 million doses by the end of March. In total, we can now expect 12.8 million doses from April to June from Pfizer alone. Cette semaine, le Canada...
This week, Canada received a total of nearly 1 million doses of COVID-19 vaccines. Next week, another million doses will arrive. Today, I can announce that Pfizer has moved up its delivery of 3.5 million doses that were scheduled for this summer. This means that in March, we will receive 1.5 million additional doses. We will also receive 1 million additional doses per month, earlier than expected for April and May. For months, we have been telling you that Canada will get a total of 6 million doses by the end of March. Minister Anand is continuing to work extremely hard with the entire team, and now we will get 8 million doses by the end of March. From Pfizer alone, we expect 12.8 million doses between April and June. Every day across the country, there are more and more grandparents calling their children, grandchildren to tell them how pleased they are to be vaccinated. To the healthcare workers taking part in the vaccine efforts, that's been a year now that you have rolled up your sleeves to fight the pandemic, and now you're helping Canadians roll up their sleeves to put an end to this pandemic. I want to say thank you to you. There are millions of other doses coming. We will continue. Let's continue to all work together to vaccinate Canadians as quickly as possible.
We'll be there with what people need to get through the pandemic. That means we're sending more and more vaccines to the provinces and territories in the coming weeks and months. It also means we're continuing to support everyone, from families and small businesses to scientists and research staff. This week, we took another step forward for Canadian research with an investment of $518 million through the Canada Foundation for Innovation. More than ever, this past year has shown just how essential it is to continue supporting science and innovation here in Canada.
Last May, we invested in providing wage support for researchers at universities and health research facilities. These employees were not eligible for the Canada Emergency Wage Subsidy, and it was important to us to help them. This investment also seeks to support research projects by helping to cover additional costs as a result of COVID-19. Today, I can share that these measures have allowed us to maintain nearly 32 people in their jobs in our universities and healthcare research institutes. Furthermore, approximately 22,000 research projects got assistance through this program, be it to maintain their essential activities throughout the pandemic, to accelerate the speed and catch up for the lost time upon the reopening. The fight against cancer and the fight against climate change and the work of our researchers is essential. They help us to improve the lives of Canadians and grow our economy. Our government will always be there to support science and the scientific community.
Speaking of building a better, stronger future for everyone, I also want to talk about what we're doing to modernize public transit. No one likes to be stuck in traffic. Better public transit connects communities and helps people get around in faster, cleaner, and cheaper ways. Yesterday, Minister McKenna and Minister Champagne announced that we are investing $2.75 billion for zero-emission buses, charging infrastructure, and other electrification projects across the country. This is part of the unprecedented commitment we made last month of almost $15 billion for new public transit projects over the next 8 years. Not only will investments like this help us exceed our 2030 target, not only will this put us squarely on the path to net zero by 2050, But these investments will also help create good jobs and grow the economy.
Yesterday, I had a virtual visit of the Nova Bus facility in Saint-Eustache. This company makes zero-emissions buses. These long-range battery electric buses can have a range of up to 470 kilometers on a single charge. Recently, the City of Vancouver's transportation system selected to purchase 15 of these zero-emissions buses and add them to their fleet. The purchase of these buses was made possible with the direct support of the federal government. This is a good example. It demonstrates that by working together from coast to coast, we can ensure that we have a cleaner, more efficient, and modern public transit system. Within the next 5 years, our government commits to putting 5,000 zero-emission buses on the roads.
Transit and infrastructure means clean air for our cities and good-paying middle-class jobs for Canadians. We not only have the manufacturing capacity here at home, but we have the materials used in today's battery technology, whether it's aluminum in Quebec or nickel in Ontario. When we build a sustainable future while growing the economy, everybody wins. There's still a lot of work to do to fight climate change and build a green economy that works for everyone, so we will continue to take real action for our workers and for our kids. Finally, I want to recognize that it's been almost a year now since COVID-19 was officially declared a global pandemic. At times, I know it feels like just yesterday, although most of the time it probably feels like a lifetime ago. This last year hasn't been easy, but we are going to get through this. This week alone, almost 400,000 Canadians got a COVID-19 shot. Next week, it'll be the turn of hundreds of thousands more. The people watching at home right now who are looking forward to getting their shot, your turn is coming. Millions of doses are on the way. Deliveries have been ramping up, and they'll ramp up even more in April. We will continue to work around the clock to make sure Canadians get vaccinated as quickly as possible. Merci beaucoup.
Thank you very much. Now, I'm pleased to give Minister Anand the floor.
Thank you, Prime Minister, and good afternoon, everyone. I would like to expand briefly on the Prime Minister's comments concerning Canada's progress on vaccines and vaccine delivery. With the newly confirmed delivery of an additional 1.5 million Pfizer-BioNTech vaccine doses arriving this month, as well as the 500,000 doses of the AstraZeneca Covishield vaccine that arrived this week from the Serum Institute, Canada is set to receive 8 million doses of vaccines by the end of this quarter.
This is 2 million additional doses than what was initially forecast for that period. This is 2 million more Canadians who will be able to get the first dose of their vaccine.
2 million more doses than was originally anticipated within this time frame. That is 2 million more Canadians who will be able to receive their first dose of vaccine. In addition, Pfizer is also accelerating April and May deliveries by 1 million doses in each of those months. With Health Canada's approval of the Johnson & Johnson vaccine, we are in the process of finalizing the delivery schedule for the 10 million doses that we have secured under contract. Deliveries are anticipated to begin in the second quarter of this year, and all 10 million doses will be delivered prior to the end of the third quarter. In all, Canada is on track to receive at least 36.5 million doses of vaccines by the end of June, and a cumulative total of 117.9 million doses of vaccines by the end of September from the 4 currently approved suppliers. Because of our diversified procurement approach, we are able to see an acceleration in doses coming to Canada from multiple suppliers. While this news of more vaccines coming is welcome and encouraging, it does not mean that the hard work is over. At Public Services and Procurement, we continue to push every day for earlier deliveries of these vaccines so that they may be deployed as rapidly as possible to provinces and territories who then can administer them to Canadians as quickly as possible. Nous aussi continuons de travailler sans
We are continuing to work tirelessly to ensure that the provinces and territories have the supplies they need to deliver these doses. These recent months have been difficult for everyone in Canada and around the world. Although we have not yet finished with these difficult times, constant progress is being made, and we are confident that we will overcome this.
Tirelessly to ensure the provinces and territories have the supplies necessary to administer these doses. These past months have been difficult for everyone across the country and around the world. While we aren't out of these difficult times yet, together we are making steady progress, and together we will get through this. As we have seen, our diversified procurement approach will continue to deliver for Canadians in the weeks and months ahead. Merci beaucoup, Miigwech. Thank you.
Dr. Tam?
Bonjour à toutes et à tous.
Good morning, everyone.
We will give the numbers update as usual, and then round up the latest developments that are giving us an increasingly optimistic outlook as we go into the weekend. To date, there have been 878,391 cases of COVID-19, including 22,151 deaths and just over 29,900 currently active cases reported across Canada. Over the past week, an average of 2,866 new cases and 41 deaths were reported daily. At the same time, over 2,100 people with COVID-19 were being treated in our hospitals each day, including about 560 in critical care. Although the decline in daily cases has leveled off in recent weeks, we are making important progress with COVID-19 vaccines. With continued public health measures and individual precautions to keep infection rates in check, there's growing optimism that we can achieve significant protection across the population in the weeks and months ahead. However, with the continued increase of cases involving more contagious variants, we need to remain vigilant, as the trajectory could change quickly. Over the last month, Canada has rapidly increased our capacity to screen for variants of concern, and we're now sequencing over 10,500 high-quality virus genomes, or 11% of all cases. That's within the last month. To date, more than 2.1 million doses of COVID-19 vaccine have been administered in Canada. And over the past week, provinces and territories have administered more than 397,000 doses of COVID-19 vaccine, which is the highest number of vaccines administered in a single week since vaccinations began in mid-December. With Health Canada's authorization of the AstraZeneca COVID-19 vaccines, we now have additional vaccine options to provide protection for millions more Canadians. In addition, after an expert review of studies showing sustained high levels of protection after the first dose of COVID-19 vaccines, Canada's National Advisory Committee on Immunization released recommendations that could provide access to more people faster. Based on evidence from clinical trials and real-world vaccination programs in Canada and worldwide, NACI, this committee, finds that extending the administration of second doses by up to 4 months could provide a safe and effective means to vaccinate more people sooner, while vaccine supplies continues to expand in parallel. Another piece of good news, of course, today is that Health Canada has authorized a single-dose Janssen COVID-19 vaccine. As we continue making important progress, I urge Canadians to stay vigilant, follow local public health advice, and keep up with individual practices that protect us and our families. I continue to be heartened by the stories of Canadians coming to receive their vaccines. From Gurdeep Panda celebrating by dancing the Bhangra on a frozen lake in the Yukon, to the joy and relief displayed by seniors in Montreal who received the first doses at a vaccination clinic for the community. We're all contributing to great achievements across Canada and around the world. So thank you.
Bonjour à toutes et à tous.
Good day, everyone. Today, we'll give the numbers update as usual, and then round up the latest developments that are giving us an increasingly optimistic outlook as we go into the weekend. To date, there have been 878,391 cases of COVID-19, including 22,151 deaths and just over 29,900 currently active cases reported across Canada. Over the past week, an average of 2,866 new cases and 41 deaths were reported daily. At the same time, over 2,100 people with COVID-19 were being treated in our hospitals each day, including about 560 in critical care. Although the decline in daily cases has leveled off in recent weeks, we are making important progress with COVID-19 vaccines. With continued public health measures and individual precautions to keep infection rates in check, there is growing optimism that we can achieve significant protection across the population in the weeks and months ahead. However, with the continued increase of cases involving more contagious variants, we need to remain vigilant as the trajectory could change quickly. Over the past month, Canada has rapidly increased capacity to screen for variants of concern and is now sequencing over 10,500 high-quality virus genomes, or 11% of all cases. This was in the last month. To date, more than 2.1 million doses of COVID-19 vaccines have been administered in Canada. Over the past week, provinces and territories have administered more than 397,000 doses of COVID-19 vaccines, which is the highest number of vaccines administered in a single week since vaccinations began in mid-December. With Health Canada's authorization of the AstraZeneca COVID-19 vaccines, we now have additional vaccine options to provide protection for millions more Canadians. In addition, after an expert review of studies showing sustained high levels of protection after the first dose of COVID-19 vaccines, Canada's National Advisory Committee on Immunization, or NACI, released recommendations that could provide access to more people faster. Based on evidence from clinical trials and real-world vaccination programs in Canada and worldwide, NACI finds that extending the administration of second doses by up to 4 months could provide a safe and effective means to vaccinate more people sooner, while vaccine supply continues to expand in parallel. Another piece of good news today is that Health Canada has authorized the single-dose Janssen COVID-19 vaccine. As we continue making important progress, I urge Canadians strongly to stay vigilant, follow local public health advice, and keep up with individual practices that protect us and our families. I continue to be heartened by the stories of Canadians coming to receive their vaccines from Gurdeep Pander, celebrating by dancing Bhangra on a frozen lake in the Yukon, to the joy and relief displayed by seniors in Montreal who received their first doses at a vaccine clinic for the community. We are all contributing to great achievements across Canada and around the world. Thank you.
Thank you, Dr. Du. We'll now turn to the phone for questions. The Prime Minister will take about 20 minutes of questions, and then the ministers and doctors will be around after that. Operator, over to you.
Thank you. Merci. To ask questions, please press *1 on your device's keypad. Pour poser des questions, s'il vous plaît, faites étoile 1 sur votre appareil. Première question, Catherine Lévesque.
First question, Kathleen Lévesque, La Presse. Yes, Mr. Trudeau. Inaudible for the interpreter.
Capable d'avoir des réponses claires de la part de l'Agence de la santé publique sur des questions très simples comme le nombre d'amendes qui ont été distribuées. Je me demandais comment est-ce que les Canadiens peuvent avoir confiance dans ce programme si votre propre gouvernement n'est pas capable de faire preuve de transparence?
Pardon, Catherine.
I'm sorry, Catherine, but there was a lot of cutting out in the first part of your question. Could you please repeat it? Inaudible for the interpreter. We will try. There's a bit of an echo here. 2 weeks ago, journalists, including myself, have a lot of difficulty getting clear responses from public health with regard to the number of fines to those violating the lockdown. How can Canadians have confidence if the government cannot show transparency? Answer. First of all, the program exists to protect Canadians. We know that with these new variants throughout the world, it will be essential to ensure that the virus does not get imported by Canadians coming into the country. Since March, Canada has imposed quarantine measures that are among the strictest in the world. For a number of months now, we have been requiring a negative test prior to people getting into a plane to come back to Canada. Now, for the past few weeks, there is a measure where there is a test upon arrival and a quarantine in a designated hotel until the results are known. We are working to improve the process. We are ensuring that people who don't obey are fined. The system is not there to punish people. Rather, it is not there to collect money. It is rather to ensure that Canadians remain safe, that we prevent the import of the virus. And to that end, we are focusing on the effectiveness of these measures to ensure that people are protected as much as possible. That's what all Canadians expect of their government.
Oui, et on comprend pourquoi vous l'avez fait.
Question. We understand why you did it, but my question was really about transparency. How can you believe that Canadians can be confident in what you're doing when they can't get clear answers from the departments putting in place these programs? Answer. We regularly publish data on the measures that are in place, and we will continue to share that information because this program has only been in place for a week or two now. So we are still collecting the data. We will continue to focus on transparency and putting forward ensuring the confidence in these institutions. Next question.
Thank you. Merci. Prochaine question, Marie Vestel.
Marie Vestel, Le Devoir. Question. Yes, I'm sorry. I thought I had pressed the button earlier. My question is for Minister Anand. With regard to the Johnson & Johnson vaccine, could you be a little bit more specific as to when the first doses will come in? You're talking about the second quarter. What month? How many could arrive? initially? Will we have to wait for the end of the summer to get most of the doses expected? Why is there a delay as well? I will start with the answer, and then I will pass the floor to Minister Anand. I spoke this morning with the CEO of Janssen Canada, who assured me that they are working to provide us with greater clarity and information as to when we will start to begin receiving the Janssen vaccine. We know that we will get the 10 million doses in the next few months before September. It is very important, however, to know when we will get as many as possible and as quickly as possible. Johnson & Johnson are establishing their global production system. They have assured me that they hope to have more details with regard to deliveries to Canada, and they will share with us in the coming weeks. We will have more. For more information, I will give the floor to Minister Anand. Anita.
Merci beaucoup.
Thank you, Prime Minister. You said, in fact, everything that I would have also liked to have said, and it was a perfect answer. So, with regard to where we stand with the supplier, in the coming weeks, we will have more information, and this is work that we do on a daily basis. Thank you. Yes, I have a more technical question. It's about the figures, Ms. Anand. If you could give us an update, as you did last week, with regard to the figures for Q1, Q2, Q3. It's starting to be a little bit mixed up. You say that we'll get 36.5 million doses by June, but what I have in my data is 8 million doses Q1, 24.5 Q2 with Serum Institute and Pfizer Moderna. So could you just give us an update by quarter and by company so that it's clear for everybody? And if you want to do it in English, okay.
Merci beaucoup. So in Q1, we are receiving 8 million doses of vaccine in total, 5.5 million doses of Pfizer, 2 million doses of Moderna, and 500,000 doses of Serum AstraZeneca. And in Q2, we are receiving 36.5 million doses of Pfizer, Moderna, Serum Institute, and the COVAX facility. I will allow my staff to break those numbers down of the 36.5 million for you. And then in Q3 cumulative, we will have received 118 million doses. And that is cumulative also, adding in the doses from J&J, which is 10 million, and AstraZeneca, which is 20 million doses. So that's how you get to the 118 million doses, and we are including them in Q3, but they will be spread out over Q2 and Q3. Once we get the delivery schedules, we'll provide specific information of the quarterly breakdown for those two companies that are the latest to be approved by Health Canada. I think the important thing to note, and you can see this from the numbers that I've provided, is that we have access as Canadians to multiple sources of supply of vaccine from Serum Institute and AstraZeneca, from Johnson & Johnson, from Moderna, from Pfizer, and Canada is extremely well placed as a result to continue to see vaccine coming into this country, despite what we are seeing in other areas of the world where countries have not diversified their vaccine portfolio or are being stymied by decisions that are being made to block exports. Thank you.
Thank you, Minister. Next question on the line, operator.
Thank you. Merci. Next question, Ryan Tumulty, The National Post. Line open.
Yeah. Good afternoon, sir. Yesterday, Italy moved, and with the support of the European Union, to block a shipment of AstraZeneca vaccines that were set to go to Australia. I know when these export restrictions first brought in, you were assured by European officials that this would not happen, that vaccines would not be prevented from going to countries, that they just wanted to track the doses. Are you concerned about what happened with Australia's doses, and do you fear that it might impact Canada's doses at some point?
Thank you, Ryan. It's obviously a situation we're following very closely, but I can repeat what I said earlier in terms of the conversations that we've had with the European Union, specifically that I've had with European Commission President Ursula von der Leyen, have confirmed to me that the flow of vaccines to Canada should not be interrupted, particularly given the fact that the vaccines we receive from Europe at this time are Moderna and Pfizer, and both of those companies have it has been reassured to us that those are not companies likely to face disruptions around deliveries to Canada. We are not scheduled to receive AstraZeneca doses from Europe for a number more months. We are receiving, as you know, the Serum Institute doses from India this month, and possible other doses from elsewhere in the world. But we will continue to work very, very closely with the European Union to ensure that none of the shipments of vaccines to Canada that we are going to be receiving in the coming weeks and months are going to be held back. Okay. Nous sommes évidemment
Obviously, we are closely watching what is happening in Europe with the delivery of vaccines. In my conversations with the President of the European Commission, Ursula von der Leyen, and our counterparts in Europe, deliveries that Canada expects to receive from Pfizer and Moderna from their production facilities in Europe should not be affected by the measures put in place by Europe. We have a lot of confidence there. We will continue to monitor with regard to the AstraZeneca doses. It will take some months before we expect to receive the doses from Europe, and we hope that we will continue to be able to count on the delivery, unfettered delivery of these vaccines.
All right. Yeah, sir. I'm also wondering, given we now have a fourth vaccine, given the additional doses you've announced today, do you think your September timeline can be moved up? Do you expect Canadians now to be vaccinated, say, by August or July?
Well, as Minister Anand just highlighted, we are expecting far more doses by September than there are Canadians, even given that we're only talking about doses from 4 different approved companies right now. So we have reasons to be optimistic. We're going to be able to move things forward. But at the same time, we also know that these are global supply chains that are being set up, and there is always possibility for disruptions. We are confident, as we have been, as I have been saying since December, that Canadians who want vaccines will be able to be vaccinated by September. But based on delivery schedules and also based on new guidelines from NACI and Health Canada, it is possible that we have further good news and good predictions to share in the coming weeks, but we're remaining focused on delivering as many vaccines as possible, as quickly as possible to Canadians, as evidenced by the good news from Pfizer today of an extra 1.5 million doses this month.
Bonjour, Monsieur Trudeau, Louis Blouin, Radio-Canada.
Mr. Trudeau, Mr. Blouin, Radio-Canada, we learned that one of your close cooperators, a member of your office, was aware of the allegations against Mr. Vance. Could you look Canadians in the eye today and tell them that you were not aware of the existence of allegations against Mr. Vance? I Don't you think you should have been aware of it? Answer. First, let me remind you that for the past 30 years, I have taken the responsibility that we all have of ensuring that we have a safe workplace and places free of harassment and intimidation. I have always taken every allegation seriously. I've never hesitated to take direct action when necessary. I will always continue to take these allegations and any concerns seriously. We need to hear, accept, and listen, and work in order to move forward the files of people who come forward with allegations. That's what we've always done. In this situation, the Ombudsman went to see the Minister to share concerns about confidential allegations. The Minister directed the Ombudsman to independent authorities responsible for these investigations. Politicians have to ensure, or the Office of Politicians have to ensure there is a follow-up for these allegations in an independent and responsible manner, and to ensure there are consequences for those who commit such actions. But there are independent authorities. They are the ones who must do the follow-up. In this case, the authorities did not get the information from the Ombudsman, and therefore there was not enough information to follow up with a deeper inquiry. But at each stage, we will always take that information seriously, and we will ensure at each stage that the men and women working in the Canadian Forces or anywhere in Canada can always be listened to and respected and supported through the processes necessary to get through this. With regard to what I said and what I continue to say, I was only made aware of the allegations against General Vance by journalists in the recent weeks and months.
For the past 30 years, from my very first days as part of the McGill Student Society Sexual Assault Center, I have always taken extremely seriously our collective responsibility to ensure safe work and study environments and to fight against sexual harassment and assault. It is something that I have never shied away from. Indeed, as leader of the Liberal Party, have not hesitated to take swift and necessary action on responding to such allegations. It is the responsibility of elected officials, upon learning of allegations, to ensure that they get followed up on appropriately by responsible, independent officials and investigators. That's exactly what we did in this situation. When the Ombudsman came forward with allegations to the confidential allegations to the Minister directed to the appropriate independent officials to follow up on that those allegations. The ombudsperson did not provide sufficient information to the officials in place to be able to follow up on these allegations. But that is something that we will always try to work through in a responsible way. Women and men who serve in the Canadian Armed Forces or work anywhere in Canada need to know that when they come forward with concerns and allegations, they will be heard, they will be listened to, and they will be able to have a process through which they can ensure an independent evaluation and examination of their allegations. This is something that we have always taken very seriously. As I have said, I only became aware of specific allegations against General Vance through the work done by global investigative reporters over the past weeks and months.
Good afternoon, Prime Minister. Christy Kirkup with the Globe and Mail. How can you allow the military to investigate itself, especially when it involves sexual misconduct allegations involving the top ranks? And why don't you commit to what has been recommended for decades and set up an Inspector General office that exists in other countries, including Germany, the US, and Australia?
We moved forward immediately on ensuring proper internal investigations in the independent systems within the military, but at the same time, the minister has committed to moving forward on establishing a more independent external process to move forward so that we can truly demonstrate our commitment to everyone who chooses to serve Canada, that they will be supported and protected in issues like this.
The minister indicated immediately that he would follow existing processes of independent investigations within the military, and that we would also move forward with the establishing of more independent external reviews to ensure that anybody who's serving their country within the Canadian forces will know that there is a place and a way to be heard when there are allegations or issues involving intimidation and harassment.
Mr. Tom Perry, CBC. Women who say they experienced sexual misconduct while serving in the military say that they've lost confidence in your defense minister over his handling of these allegations against General Vance. What do you say to these women?
That we understand that there have been challenges and incidents and problems around sexual harassment and sexual assault and intimidation and inappropriate behavior in our military, like in so many institutions and organizations around this country. And over the past 5 years as a government, we have taken significant steps to improve and enable people to be able to come forward, people to have confidence in not just reporting mechanisms, but also in transforming workplaces and work environments so that people can be safer and fully respected in dignity. This is something that we continue to work on, that we take extremely seriously as a government and as a country. And we will continue to work with survivors, to respect their wishes, to hear them, and to improve the systems that both support them when things happen, but even more importantly, create cultures where incidents of the sort don't happen from the very beginning.
We know that within our Canadian forces, as within many organizations and institutions across the country, that for many years there have been far too many incidents of harassment, intimidation, and assault. It is our duty together to work, to continue to work, to create a system where people can report and get justice, but also to prevent this from happening within these institutions or allowing this to continue by not being strong enough in the actions we do and the processes we put in place proactively. In the past few years, we have put in place many things. We have much left to do, but I repeat that we will always be there to listen to and support and accompany those who have been subject to harassment and intimidation. And we will be there to improve the workplace culture, organizational culture, in order to ensure that there are fewer and fewer such instances in the future. Everyone serving their country should not be subject to intimidation or harassment.
So with Global National, just based on what you knew and when you knew it about General Vance, had you been aware of the allegations against him, would you have still extended former CDS Jonathan Vance's term? And should your minister or your staff have told you about these allegations when you were considering extending his term?
I'm not going to engage in hypotheticals. What I will say is that there is a strong and serious and rigorous investigation underway, and we are moving forward with further measures to create structures to give even more confidence to Canadians about the support we give to survivors and the changing of cultures within the military and other institutions. This is something we take very, very seriously, and we will continue to move forward in ways that keep people safe.
I won't comment on hypotheticals, but what I will say is that we are conducting a strong and rigorous investigation to have all the facts on the situation and look at how we can improve the systems and structures in place to, first of all, ensure that complaints or concerns are better followed up on with the appropriate authorities, and to ensure that the culture does not allow this to occur again.
Good afternoon. Mia Rabson from the Canadian Press. Now that Johnson & Johnson has been approved, we have 2 vaccines that potentially could also be produced in the United States. Just wondering what conversations you're planning to have now with the United States about getting doses from there, what Canada can put on the table to try and convince the Americans to help export, and what timeline you might think that Canada could get doses from the U.S.
As I've pointed out, we've had excellent conversations with the American administration on fighting COVID-19 and on the integration not just of our supply chains, but of our economies across the Canada-U.S. border, which means we do need to be working together to make sure we're coming roaring back from this pandemic as quickly as possible. Obviously, in terms of sourcing vaccines, it's going to be extremely important that we get the vaccines that we have been contracted for, including from production facilities in the United States, and that as we move forward into the coming months, we do everything we can to support each other as we move forward. Those conversations are ongoing.
Glenn McGregor, CTV News. Prime Minister, we heard yesterday from the premiers about the growing wait lists, the huge backlog of elective surgeries, in some cases in diagnostic testing, caused by the pandemic. They want an increase in the Canada Health Transfer, as you know, but you've said you want to wait until we get through this before you have that conversation. They say they need to know now when the money is coming. Will you consider accelerating that process to increase the Canada Health Transfer in this year? And if so, are you willing to meet their 35% of the health costs that they say the federal government should provide?
From the beginning of this pandemic, the federal government has been there for Canadians. We've transferred billions of dollars to the provinces for their healthcare systems, for things from PPE to rapid testing to vaccinations now. But we've also worked to support their healthcare systems and ensure that we're able to get through this pandemic. We've also sent hundreds of billions of dollars directly to Canadians. Indeed, through this pandemic, over 8 out of every $10 on pandemic supports for Canadians has come from the federal government. We have demonstrated our willingness and our desire to work in partnership with the premiers every single step of the way, and we will continue to. The priority for all Canadians right now is to get through this pandemic. And that's what we're focused on, and that's what we will continue to do. We made a simple promise. We will be there for Canadians as much as it takes, as long as it takes to get through this pandemic, and that's something that applies to the premiers as well. Now, as we get through this pandemic, and once we're on the other side, it is obvious that there will be a need for greater financing of healthcare in this country, including through the Canada Health Transfer. And as I've said to premiers, we will be there to increase those transfers. But that conversation needs to happen once we are through this pandemic, because right now, the supports we're giving to Canadians are the ones that are needed to get through this pandemic. And that's what we're going to stay focused on while we work hand in hand with the provinces.
Since the beginning of the pandemic, we made a promise to Canadians. That promise was that we would be there for them as long as it took, with everything that it requires. And that's exactly what we've done, including with the premiers of the provinces, to whom we have transferred tens of billions of dollars to ensure that, yes, they have the equipment they need, but also to ensure that the healthcare system can continue to operate during the pandemic. It's clear that after the pandemic, we will need to invest more in the healthcare system, and the federal government will be there to do that. But as we have demonstrated with our presence in people's lives, is that 8 out of $10 provided during the pandemic has come directly from the federal government. We will continue to do everything necessary throughout the pandemic to help people. After the pandemic is over, yes, absolutely, we will sit down to speak with the provinces and territories about how to increase healthcare transfers and ensure that Canadians are well served by a renewed post-pandemic healthcare system. Absolutely, but those conversations must take place after we get through this current crisis.
Thank you.
Are you still confident in the decisions being made by Minister Sajjan, the Minister of Defence? Yes, absolutely.
There are a couple more questions as well.
Okay, that is the Prime Minister of Canada on this Friday. We're going to dip away from this press conference. We're waiting for a press conference by the Premier of Ontario, Doug Ford, at the top of the hour. So just wanted to do a bit of a debrief before I hand things over to my colleague Andrew Nicol. I'll bring back Catherine Cullen and David Cochrane to talk about some significant news there. As you had telegraphed, David, that there was going to be a bit of a surprise, and it is good news too, I would say, for Canadians who are anxious to get the vaccine.
Yeah, it is good news. Pfizer is accelerating deliveries yet again, an additional 1.5 million doses to Canada before the end of this month, an extra million in April and an extra million in May. So 3.5 million doses we were due to receive sometime between July and September, now arriving in the next 60 to 90 days. And, you know, the math on that is that's enough to vaccinate the entire adult population of the province of Alberta at least once, to give them their one shot. So that is a significant bump in the early supply. The original plan of getting 6 million total vaccine doses by the end of March has now been bumped up to 8 million because of the extra 1.5 Pfizer and the 500,000 AstraZeneca Covishield that came from the Serum Institute in India. So after a really sluggish, slumpy start, Canada's vaccination supply and efforts are ramping up and increasing and moving in a positive direction. If you listen to Minister Anand there, who did a little bit of an I told you so to people, I think, in that news conference, that they're going to have 36.5 million doses of COVID-19 vaccines by Canada Day, and that number does not even include the AstraZeneca supply that should come from the US and maybe parts of Europe if that gets sorted out, and the Johnson & Johnson vaccine, which was only approved by Health Canada today. So the number is moving rapidly in the right direction, and the government's take is that you're seeing the benefit of this diversified portfolio of suppliers. The strategy that they decided to undertake last summer, you're seeing the acceleration and benefit of that by being able to tap multiple sources at the same time. And when one or two of those can ramp up, then the whole country gets a big jolt.
Yeah, if you can't produce your own vaccine, which would of course be the ideal solution, I would say, during a pandemic, you can at very least try and get as many different kinds as you can. It was interesting to me, Catherine, that the Prime Minister didn't, however, want to move goalposts or didn't want to say that on the record anyway at this stage.
Yeah, and in interesting as well, some of the questions he was getting around the European Union and future impacts that might have. You know, this is a recurring message from him that we're on top of this. We continue to have conversations about it. The conversations I have had thus far certainly give me confidence. But he was really making the point that, you know, when it comes to Pfizer and Moderna, we're feeling good. In the immediate future, our AstraZeneca doses are not coming from the European Union. I think we can sort of read between the lines there that this is an issue that the government feels it has to stay on top of, that there is the possibility that this could play itself out as an issue with some future doses remains to be seen. But for the time being, I guess essentially was the message from the Prime Minister, this doesn't seem to be a concern.
In fact, we now, with Johnson & Johnson, the timeline, if all goes according to plan, which is always the caveat we have with this story, 118 million doses would be in Canada by the end of September, which is obviously more than we need. And I think then there would be questions about what do we do with the extras? Do we give some back? Do we send some to developing nations? Do we hold on to them in case we need boosters? I mean, there's all sorts of questions around that. Just before I let you go, I want you both to just weigh in on the questions around the Minister of National Defence, Harjit Sajjan, and the Chief of the Defence Staff, former Chief of the Defence Staff, Jonathan Vance, who's facing some allegations. There was testimony earlier this week from the former military ombudsman who said that he tried to get these allegations to the